Nerve conduction study, or the EMG, is done for the patient who present with weakness, tingling, or numbness because of a disease of the nerve, muscle, or both. The test consists of two parts. The part one, done by technologist or technician, consists of checking the nerve function using electrodes, and the patient will feel like a static or a very small electrical shock.
Do you feel it? Mm-hmm. All right, it's gonna get a little bit stronger.
Okay.
A little bit more. Next, your wrist is gonna jump.
Okay.
And bigger.
The second portion is the muscle portion, needle examination, which is done by physician. Most of the time gonna be electromuscular neurologist, trained neurologist. And it consists of sampling muscles using small needles. I'm gonna say 1, 2, 3, then I'm gonna stick.
Okay.
Anytime you feel uncomfortable, you can let me know, we can stop.
Okay.
Thank you. Here we go. 1, 2, 3. Laura, how do you feel?
Great.
Is it uncomfortable?
Not at all.
Both parts are read together because they are complementary. And neurologist gonna do the second part and then also gonna do the interpretation and report the test. So when the test is ordered and scheduled, the technician will contact the patient about the test. They will go over the details of the test. They will ask certain screening questions, including if you are on a blood thinner. They will also suggest what to do on the day of the test. They may suggest that the test will last for an hour. Do not use any lotion because that can interfere with the test procedure. And they explain that you don't need to be fasting. And when you come to the room, the technician will first talk to the patient and they will explain the process. And then the first part of the test will be completed by the technician.
All right, that's the end of the test. You can go and sit on the edge of the bed here. How did everything feel?
It didn't hurt at all. It just felt kind of weird.
Okay.
The second part by the physician. And then when the test is finished, then you are ready to go. They will make sure there's no ongoing bleeding or swelling. And then you can drive back home. So compared to the first part of the test, a lot of patients like the first part, not the second part. What do you think?
It was the easiest test I've done.
So when the test is completed, the patient still may have soreness at the places where the electrical stimulation were done or where the needle was inserted. There may be some bleeding spots, but those are cleaned. And most of the time, we say the patient, if they have persistent pain, without swelling or without bruising or bleeding, they can use over-the-counter Tylenol or Aleve. Most of the time, the pain will subside in 12 to 24 hours. Normally, there's no swelling or bleeding or ongoing bleeding on the site of the test. Then we explain that they need to contact their referring physician for the result of the test. For the neurologist, they can make a follow-up because the test is complex, so it requires a sitting together to explain the results. It may take 1 to 3 business days before the tests are available in the electronic medical record.